It's a problem we've all heard about for years, the struggle to attract and retain doctors in small communities. Northern Health says that used to be a problem in Mackenzie and is part of the reason why it's instituted a group practice model where doctors share patients. However, some residents are expressing frustration with how the program is being carried out.
Whether it's an emergency or a scheduled appointment, patients in Mackenzie end up here, the Mackenzie and District Hospital and Health Center. Brian Mark is one of those patients, and in recent months he has not been happy with the center's services.
It's people getting used to what it is that Northern Health is doing with absolutely no notice to the public, no advertising, nothing on the radio, nothing in print.
Mark says he's had a number of challenges since Northern Health switched to a new appointment system in June. He says lineups at the walk-in clinic are long, and the wait times to see his personal doctor can be several weeks.
Hello. When you want an appointment with your own doctor, if that particular doctor is not here this week or is booked up, call back next week.
Northern Health has implemented a group practice at the health center. Doctors work on rotation with varying hours and staffing levels depending on the day. Physicians are paid a flat rate rather than receiving a fee for service. Mark says at times he's waited 2 to 3 hours to see a doctor. Once inside, he's been told he only has a 5-minute appointment to address a single issue.
If you have a single issue, we'll book a smaller period of time, just to be efficient and to allow as many people in as possible. If you have a longer issue, I know for a fact that we book longer appointments.
Michael McMillan says he's not familiar with the 5-minute rule, and people are welcome to book with specific doctors if they'd rather wait, but he says a rotating practice works much better in smaller communities like Mackenzie.
It is critical to support physicians to have a balanced lifestyle, because if you're working 24/7 and on call and always working, people burn out, and that's what puts communities into crisis.
Mark would also like to see representation for Mackenzie on the board of directors for Northern Health. Those appointments are determined by the BC government. In Mackenzie, Ryan Kessler, CKPG News.